If you're getting ready to come into Medicare, either you're turning 65 or you're about to retire and going to leave your group plan, you've likely found out there's a lot of choices you have to make. And there's a lot of information you need to understand to make sure that you make the right decisions. So I'm going to go over pretty quickly an overview of kind of where you're headed, what Medicare is, Medicare Explained, and I'll show you exactly the things you need to know. So stay tuned.
Medicare on video, Medicare on video.
Okay, so here we are. We're about ready to come into Medicare. And the great news is Medicare is terrific. You're going to absolutely find it to be a much better solution for your health insurance than what you've had previously. So generally, costs are lower, benefits are better. Everything's pretty good in the Medicare world. But there are a number of choices that you have to make, and some of them are really important that you don't want to mess up. So let's go over a little bit on how Medicare works. And I'm Keith Armbrecht, founder of Medicare on Video, and I help people across the country with their Medicare choices, and I can absolutely help you as well. And the best part is it doesn't cost anything to use me to help you. So I certainly hope you'll allow me to help you, and that way we can make sure we get all your pieces in the right places. So I'll ask first, if you find this video helpful, please take a minute, just subscribe to the channel. That way you'll always have access to my videos. You can give it a thumbs up if you like it. And if you are so daring to leave a comment, I'll also reply to any comments. So make sure you take just a minute to help me out. It helps YouTube understand that it's important and people will benefit from the information. So let's talk about kind of an overview of Medicare and kind of how it works, because most people really haven't had an introduction when they're ready to come into Medicare. So the first thing we're going to talk about is when are you eligible? So a lot of people are a little confused because they can mix it up with Social Security, age 62, things of that nature. So there's really a couple of different ways where you become Medicare eligible in the kind of normal scenario. So first one is when you're turning 65. So that's the majority of people when they turn 65 come into Medicare. Now that's not everybody, but that is the majority that when they turn 65. But these days, a lot of people work after 65. And if you work for a company with a good health insurance plan where they pay for most of it, you might likely choose to stay on your group plan until you're ready to retire. So that's really the other way to come into Medicare, is when you retire. Now, a couple things to understand here is we have different pieces of Medicare. And when we're talking about Medicare, we want to understand those pieces. And they are Medicare Part A and Medicare Part B. When you come into Medicare, it's really Part B that is your trigger. So if you're turning 65 and you're coming into Medicare, you're going to start your Medicare Part B. If you are going to stay at your job and you work for an employer that has more than 20 employees and it has great health insurance, you're going to stay on your health insurance till you're 68 or 70. What you don't want to do is start your Medicare Part B. So very important to understand that if you stay on your group plan, you do not want to start your Medicare Part B, because that is your trigger later when you come off of your group plan at age 70 or 68 or 75, however long you're going to continue to work. When you start your Part B, it makes it like you're turning 65. So you can have freedom of choice and pick anything you want without any medical questions or any qualifications. So very important to understand, you don't want your Part B to start until you come into Medicare, whether it's at age 65 or whether it's later when you come off of your group plan. So that's the first thing to understand, and certainly a big thing. Now, we're going to talk now about decisions and what your decisions are and what your choices are. And decision number one, and this is certainly the big one, when you come into Medicare, you have a choice to make. Either you're going to stay on original Medicare, which is Medicare A and B, or you're going to choose to go into a Medicare Advantage plan. And they are significantly different. So it's important to understand exactly the differences between them. And full disclosure, I only choose to sell Medicare supplement plans. So I only work with original Medicare. I choose not to offer Medicare Advantage, and there's some specific reasons for that, and I'll explain that in just a minute. But just so we don't have any confusion, I'll tell you exactly what I think on how things function. So when you come into Medicare, you have two roads. You're either going to stay on original Medicare, and if you stay on original Medicare, you'll have A and B. You'll likely get a Medicare supplement that covers what A and B does not, and you'll likely have a Medicare drug plan. So there's kind of three pieces to original Medicare. If you choose to go to Medicare Advantage, then it's kind of all in one package. So you don't have to make the separate choices, but that can be a little limiting as well on what you have. So I'll explain exactly the differences between them here, and then that way you have the information you need to make the choices. So original Medicare, again, is Medicare Part A and Medicare Part B. And we remember, we don't want to start Medicare Part B, regardless of this choice, until we are ready to come into Medicare. So let's make sure Part B does not start until we are ready to come into Medicare. On original Medicare, you'd likely have a Medicare supplement plan. So a Medicare supplement plan covers what A and B do not. So Part A is hospital. I have videos on all this. I'll show you where to find that in a minute. So I break everything down piece by piece in many, many different videos. So a little too much to put into one. But Part A basically covers hospital services. Part B basically covers outpatient and doctor services. So there is a pretty high deductible on Part A, and there's a smaller deductible but coinsurance on Part B. So the Medicare supplement kind of supplements A and B and pays what they do not. So it covers you almost to 100%. And that's in another video as well, Best Medicare Supplement. You can find that. I'll show you where to get there. But terrific coverage. And you're probably coming out of a plan right now that has a $2,000 deductible. If you're on regular individual insurance, you might have as much as a $10,000 deductible. So this will get your out-of-pocket costs to where it can be less than a couple $100 a year, which is pretty terrific for over 65 health insurance. So keep that in mind. Medicare is actually a very good thing. So with A and B and a supplement, you probably also get a Medicare drug plan. So that covers your prescriptions going forward. And that's all something that I help with, and that we can put together a complete plan for you. And generally, with everything included, A and B, because there's a premium for Part B, there's a premium for Medicare supplement and a premium for drug plan. But generally, everything combined is almost always less than $300 a month. So it's very affordable. And again, it gives you terrific coverage going forward. So with original Medicare, what you have is low out-of-pocket costs. So you also have low upfront costs, but the out-of-pocket, when you use it, is significantly less than what it would be on a Medicare Advantage plan almost always. So the best part about original Medicare is there are no networks. So you don't have to work within a network of doctors or a network of hospitals. You can literally go to any doctor, any hospital, anywhere in the country that accepts Medicare. So if you come down with a catastrophic condition, God forbid, and you want to go to Mayo Clinic, you can go to Mayo. You don't have to ask for permission from anyone. You can simply go to Mayo Clinic. Or if you want to go to Duke University, anywhere you want to go. Or if you travel a lot, that's also a major benefit to original Medicare. You don't have to worry about whether your doctor is in a network or not in a network and where you're traveling. It gives you the freedom to do what you want, and you don't have to ask permission to have something done. And that's the number one reason why I am pretty much completely on the side of original Medicare with a Medicare supplement, is because if I am in a situation where I have a health issue, I don't want to ask permission for what I want to do. I want to be able to make my choice on where I want to go. So that's why I would typically almost always choose original Medicare. And again, Medicare Advantage absolutely works for some folks, and I'll show you that right now. We'll talk about Medicare Advantage. And Medicare Advantage is when you make that choice, you pretty much move away from original Medicare and you go into the network of an insurance carrier, whatever major insurance carrier. And you certainly see the commercials on TV all the time. They're trying to entice you to get in, and they do give away some additional benefits. So they do market more than what you would see. You won't really see Medicare supplement very rarely on TV. It's almost always Medicare Advantage. So it's just a question of how you view things. It's more of a pay-as-you-go type scenario with Medicare Advantage, which means it has lower costs on the front, but it has higher costs generally when you use it. Now, the biggest reason, again, that I'm not a big fan of Medicare Advantage is because it puts you in a network. You have to use certain doctors and certain hospitals. And if you Google reviews on Medicare, generally anything negative, and there's a whole bunch of them, generally refer to Medicare Advantage, and mostly because of the network. Either a doctor was there and is no longer there, and that they didn't have the ability to go to certain doctors that they wanted to go to, kind of scenario, or there's a long wait for a doctor office visit. And some Medicare Advantage plans, you actually have to have a referral to go from a primary care doctor to a specialist. So if you have a scenario where you need to see a specialist, you would have to go to a primary care first, set an appointment, wait however long it takes to get in, get a referral, then set an appointment with the specialist. And again, it can take just a tremendous amount of time. And it's just not something that I would want to face when I'm looking down the road at potential health issues. So that's one of the scenarios with a Medicare Advantage plan. The other one, again, it's kind of a pay-as-you-go. They can have as much as $6,000 annual out-of-pocket expense, where a Medicare with a Medicare supplement would have a couple $100 annual out-of-pocket expense. So it can be significantly different in how it functions when you're going. So just keep that in mind and absolutely do some research. And you'll find most of the time there are salespeople out there that are absolutely selling Medicare Advantage. They are trying to sell it to you. So just be aware and ask questions and understand how you want things to function. And again, I'm happy to help with any of this, whether I offer Advantage or not. I'll give you a straight up opinion. So if you want to give me a call or send me an email, I'm happy to do that. If you want to visit my other videos, and again, I have videos on just about everything, and it'll break it down piece by piece to make sure you understand what your choices are. You can just simply visit www.keithsvideos.com. Brings you right to my YouTube channel. You can use this little magnifying glass at the top to search by topic. So if you're looking for Medicare supplement or drug plan or Part B, whatever it may be, just put that in the search term and it'll bring up whatever videos are relevant to that topic. So I have over 100 videos now, so it makes it easy to kind of search between them. So I'm happy to help with any of this. And again, if you found this helpful, please subscribe to the channel. Helps me a lot, helps YouTube know it's valuable. Leave a comment if you're so daring, and I'll absolutely respond to it. And again, I'm happy to help with all of this. And then also make sure you visit my website at MedicareOnVideo.com, put in your basic information, and we'll get you a quote on the best Medicare supplement plan in your zip code so that you can understand exactly what the costs are. And then we're happy to walk through it with you to show you what we think is the best scenario. And again, whole different story on Medicare supplements, Plan G, Plan N, used to be Plan F. I have a video on all that. And again, we're happy to just walk right through it for you. So if there's anything I can do, I'm happy to help. And I hope you found this helpful. Take a minute to subscribe. And I hope you have a fantastic day.
Medicare on video, Medicare on